Hello everybody, I'm Dr. Sushal Shantakumar. I'm a consultant shoulder surgeon in Manipal Hospital's Old Airport Road, Bengaluru. I'll give you a brief insight about injuries in the shoulder, which I routinely see in my 10 years of practice so far. So the injuries in the younger age group, like let's say in the 20s and 30s, are predominantly labral injuries or what we call ligament injuries. Injuries in the older age group, people who are above 40 and 50, typically they tear their muscles, which we routinely call them as rotator cuff. So what would I suggest is, if you have played an activity, let's say sports or tennis or swimming, and then you have persistent pain in the shoulder for about more than 2 weeks, I think it's prudent to see a shoulder surgeon. So what do? Once I've ruled out any major fracture or any injuries, one of the first things I ask for is an MRI. MRI will tell me the complete picture. You might have a partial ligament tear, sometimes it might be a full-blown labral tear. So depending on the pathology, the treatment will be tailored to the individuals. So most of this can be managed conservatively. I think the misconception is every ligament tear needs a surgery. It's not so. Sometimes if the ligament is in the upper part of the labrum, we call it slap tears. We routinely manage these conservatively. However, if the ligament injuries are in the lower part of the socket, these might require a surgery. We do something known as arthroscopic surgery. It's a simple keyhole surgery wherein we go inside the shoulder joint and repair it with anchors. And then after a small period of rehab, by about 4 to 6 weeks, you should be able to recover most of your activities. Now coming to the other group, that is above 40, above 50, the older age group. So these patients tend to have rotator cuff tears. What happens is, over a period of time, the muscles might get degenerated, and simple injuries like a simple smash can cause a heavy swim can cause a muscle tear. So these also can be picked up with MRI scans. And again, not every rotator cuff tear needs surgery. Most of them can be managed with physiotherapy. In fact, we have newer techniques. I can inject biologics. Sometimes a steroid will help. But if you do have a full-blown rotator cuff tear and it's symptomatic, bothering your day-to-day activities and causing significant weakness, arthroscopic surgery is an option. Like I said, it's a keyhole surgery, routinely performed with just minimal stay in the hospital, maximum of 1 day in the hospital, and following adequate rehab, you should be able to recover your full range of motion. And what's more, you'll also get back your strength and you'll be able to get back to the field or your sports activity.